So now we're in the pushing phase of birth. So now the baby has come down the pelvis, down through the pelvic floor, down through the cervix, and now down into the vagina. Some women are starting to feel at this stage, if they haven't got an epidural, they've got some urge to push, okay? It's quite an instinctive thing. It's like a reflex, like a cough or a sneeze. It's not very easy to hold the pushing urge back. So a lot of the time we're encouraging you to go with your body and push in a way that feels natural to you, okay? Sometimes the contractions can space out a little bit and start to last longer, but not every time. Sometimes they do still stay in quite a regular pattern of 3 to 4 contractions in 10 minutes. Some women get quite anxious in pregnancy, thinking about when will I know when the right time to push is, but your baby will let you know when the right time is, and when your body starts to give you those signals, again, we just encourage you to go with that feeling, okay? So as the baby starts to come down through the pelvis, you will often feel it's a pressure in your back passage, okay? So a lot of ladies feel a bit nervous when they feel the pressure in their back passage, because it's a very similar sensation to if you want to have a bowel movement, okay? It's nothing to worry about. Nature is very clever in that it's likely in the days running up to labour, you may have had some episodes of loose bowel movements where you've been to the toilet quite frequently, so it's unlikely that there will be any waste in the back passage at the time that your baby's been born. If there is anything there, please don't worry, we're very discreet, you will not know, and we will make sure that everything is moved away and that no one is none the wiser that it's happened, okay? So a baby's head will start to come down further with each time you're pushing, and it can sometimes feel like the progress is a bit slow, but obviously if it's your first baby, this is the first time that all these tissues have ever stretched before, so it has to be quite slow and gentle for you, and also quite slow and gentle for the baby, because I'm not sure if you're aware, but the baby has actually got the soft spots on its head that allow the bones of the baby's skull to overlap, okay? And we want this to be done very gently and very gradually. So as the baby is starting to come down through the pelvis and is getting lower and lower and lower, you'll find that if you're in a position that's an upright position, you'll find that it's very easy then for the sacrum, the tailbone in the back, to actually flex out of the way to allow the optimum space for baby to come down and through this part of the pelvis. You may then find that the urge to push continues, and generally as we're looking and we can see what's happening, we may then start to actually see some of the baby's head peeking out of the entrance of the vagina, but often we might then see that the baby's head will go back, and that's normal progress. Again, it sometimes feels a bit like 2 steps forward and 1 step back, but then again, that is just everything stretching very gradually and the progress being consistent but slow, okay, for the baby and for your tissues down below. So the baby's head at this point now will start to emerge, so you're going to get a push, and then in between the contractions, the baby's head may go back, and then another push, and then gradually the head will start to advance further, okay? Some women will report that they feel sort of like a stinging or a burning sensation at this part as the widest part of baby's head starts to come through. That's very normal, and it's very important that you remain quite calm, that you focus on your breathing, and you focus on the midwife that's caring for you if that feels appropriate in that moment, to have that eye contact with her, and she will help guide the birth of the baby's head so it's very slow and that it emerges in a very gradual way to allow any minimal risk of any tearing to happen, okay? Something that we will offer to do as well as the baby's head is coming through is something called manual perineal protection. And what that means is as the baby's head is coming and is being born, the midwife will offer to put a little bit of gentle pressure against the top of the baby's head and a little bit of pressure with her fingers there on the perineum. So that's the area of skin between your vagina and your back passage, okay? And that will just help very gently for baby's head to be born, very slowly, so you can work with your body to push, and the midwife will help to guide the baby's head out if you're in a position that allows, and if you're happy for the midwife to do that at that time, okay? So the baby's head will be born, and then there's a period of it's called restitution. So what happens then is the baby gently turns, and that allows the shoulder to be free and to come under the pubic bone. And then there's sometimes a little bit of a pause, and then with the next contraction, you'll push, and then you'll give birth to your baby. So people do often ask how long it takes for you to be able to push your baby out. And the answer is different for every woman because we're all different, okay? Sometimes depending on where the baby is, the position of baby before you start the pushing phase or before you get to the end of the first stage of labour, sometimes baby has to actually rotate into the most optimal position to be able to get down into the pelvis as it's coming down and you're pushing. But generally, I think with the first time mum, we're looking at about an hour before we can often see much progress externally. But if mum and baby are well, it can be quite common for you to be pushing a little while longer than that, as long as you and baby are both well and you're happy to continue to push. If you've had a baby before, the pushing phase of birth is often quite a lot faster because your uterus has pushed a baby out before and your tissues have stretched to accommodate the head of another baby before. What will happen after you've given birth? Once your baby's in skin to skin with you, the midwife will offer to look down at your vulva and vagina to see if you've had any tears, okay? Even with the most controlled pushing and very good calm breathing as you're giving birth, most first-time mums can have some degree of tear. And even if that's just a little bit of a tear to the skin that doesn't require any stitches, or it can be a more extensive tear that can involve the muscles of the vagina or the muscles of the back passage as well. If it's a first degree, which just involves the skin, or a second degree tear, which involves the vaginal muscles, often the midwife that's been caring for you or one of her senior colleagues can do that repair in the room that you've given birth in. So they will put some local anaesthetic down into the area, like when you go to the dentist and it makes you numb. Put the local anaesthetic down in that area and put some sutures in, some stitches, just to bring the edges together and to promote healing. If the tear is identified as being a little bit more extensive, so it's going down into the back passage muscles, that's not something that would be repaired in the room, and we would ask a doctor to come, have a talk with you, and then you would likely be taken down to theatre at that time and be offered a spinal, which is like an epidural for when you're giving birth, but it's just a spinal that will numb the area completely if you've not had an epidural in labour. If you have had an epidural in labour, they may be able to likely top the epidural up so you're very comfortable so that the doctor can assess where the tear is and make sure that is repaired expertly. The last thing I need to tell you about is after you've given birth and the doctor or the midwife has checked your perineum and your vulva and vagina for any tears, the midwife may ask to do a rectal examination, and that involves the midwife inserting her finger gently into your back passage to determine if there has been any tears that have actually gone through to the back passage muscle. This can be very helpful for us to be able to determine the level of tear and to make sure that any tears are identified, assessed and repaired appropriately.